lot of people are developing diabetes आज के डेट में. So is it necessary कि किसी को diabetes है तो उसको diabetic retinopathy होगा ही?
See, most of the patients having diabetes, they have diabetic retinopathy to some extent or the other. But as I discussed about the normal anatomical structure of the retina, so the center of the retina, which is called the macula, is responsible for 90% of your vision.
Okay.
So until and unless that part is getting affected by diabetic retinopathy, so a patient cannot diagnose this thing like I am seeing less, or if it is happening surrounding that center part, he is not or she is not aware of that thing.
Right.
So it's like in the early stages when the center part is not affected or not fluid accumulated in the center part, so the patient is like feeling like I am not developed any retinal condition due to diabetes, but it's not like that.